Are there other federal policies that make it difficult for physicians to actually take the lead in reforming the healthcare system?
I'm so glad you asked about that because it's so frustrating as anybody who is any physician for sure, an independent physician, but also when you've been a physician advocate, it's really frustrating because there is kind of a structure of federal law that was enacted, decades ago that really has put physicians at a disadvantage in terms of developing physician-led delivery systems that can compete with these corporate-owned entities. There's a whole host of regulatory laws. So the antitrust laws, obviously, there are self-referral restrictions that are really make it really difficult for physicians to ever refer to entities that they own an interest in. There is a moratorium on physician-owned hospitals. The hospital association has done a fabulous job of lobbying to protect against physicians owning hospitals. And so we have this whole regulatory infrastructure that has made it impossible for physicians to actually lead healthcare. And which I think has truly contributed to this situation now where we have corporate entities owning and kind of controlling the system. And so a lot of what PAI advocates on, I know the AMA is active in this area as well. We really talk about leveling the playing field so that physicians can offer consumers, patients in this country, an option to go with a physician-owned, a physician-led organization to deliver their healthcare. I think most people would feel more comfortable with doctors running the show than, a massive organization that has, billions of dollars of revenues to their shareholders every year. So that's something we're working on. We have a study that we recently did showing that physician-owned hospitals actually deliver care much more cost effectively for the top 20 DRGs that they provide care to. I mean, we're just trying to offer as much evidence as we can that physicians, if they are able to do so, can provide a competitive, high quality choice for patients in this country, and that federal regulators need to modernize and federal and Congress needs to modernize laws to reflect the changes that have occurred. I mean, we're not working anymore in an environment that's all fee for service. Everyone is under intense pressure to provide value-driven care, right? Which means the same quality care, but for a more cost-effective manner. So the incentives are the same. And so to disqualify physicians from actually being able to lead and design those care, physicians who know more about, right, the way care should be designed clinically, it just doesn't make any sense. It's so frustrating for everybody and for everybody involved in physician advocacy. So.